Hello, my name is Dr. Stanley Lang. Welcome to this broadcast, which is on the topic of what is Lyme disease, and a little bit about myself. I've been a family practice doctor for more than 3 decades. I'm known as the whole health doc because during that time I have attempted to integrate whole person health, which is health of body, mind, and spirit, into the things that I do. So some people call this a holistic approach, and the approach that I use has evolved over the years, of course, and the approach that I use for multiple chronic diseases has also become more whole person or holistic in strategies, as I have seen that traditional medical therapies aren't working as well as they might have in the past. So the question about what is Lyme disease came up with a patient that I saw recently who'd been diagnosed with Lyme disease many years ago. And this person had been treated a couple of times with antibiotic therapy, but never for longer than 30 days, and had seen multiple doctors and 2 people that specialize in Lyme disease. One of the persons that he saw said he'd been treated too long already with antibiotics, and another person suggested that he needed a much more aggressive approach using IV antibiotics with sustained treatment over multiple months. And so we see these sort of alternative strategies, opposite ends of a spectrum, really. And what that points to is that we don't have good research about Lyme disease. And that's one of the things we talked about, is that whatever we have to talk about Lyme disease is not based on any really good research. Now, a lot of doctors have developed observational strategies. That means that they have research in a sense that they have tried things with patients and they see what works and what doesn't work. And that's kind of observational research, and that has some validity, but it can have a lot of bias that confuses the outcomes. And so anything I'm going to share with you today has that same limitation. We don't really know a lot of the details about Lyme disease because very high quality research simply hasn't been done. And I have access to some very smart doctors that practice in other countries than the United States. So this isn't just a United States phenomenon. There's not any really good research anywhere, but there are some people that are doing what I call some breakthrough strategies that are getting better and better results. So I do pay attention to these ideas, and I've integrated them slowly into what I do for treating Lyme disease. So back to the question, what is Lyme disease? Is it just an infection, or is it something else? Now, a lot of doctors that are infectious disease doctors pretty much are taught that you treat Lyme disease for 4 weeks at the most, and after that, any symptoms left over, it's just because of damage that the Lyme organism did, and it's not from ongoing infection. Now, I think, fortunately, there are an increasing number of doctors that are infectious disease doctors that realize that that's not true. And I know one that does recommend long-term antibiotic therapy, similar to what I do. It's not exactly the same strategy, but at least there's sort of a shift happening where people are starting to recognize that 4 weeks of antibiotic therapy isn't going to cure chronic Lyme disease. So there's a difference between acute Lyme disease and chronic Lyme disease. So I'm talking mainly about chronic Lyme disease in these comments. Acute Lyme disease is when somebody gets a tick bite and within days they're really sick and they start antibiotic therapy, and within 10 days they're better. So acute Lyme disease seems to get better pretty quickly with 10 days of treatment, although there are some doctors now that think that even acute Lyme disease should be treated a lot longer than that. Now, one of the problems that I see the most with Lyme disease actually is the idea that one dose of an antibiotic after a Lyme exposure potentially by a tick bite, a known tick bite, is sufficient to prevent Lyme disease. Now, I can tell you there's absolutely not a shred of research to support that conclusion. It's a sort of a consensus idea, but it's not based on any research. And I think it's a harmful idea because it undertreats people who have potentially been exposed to the Lyme organism. The concept of this one dose is based on the idea that it takes a while for the germ to get from the tick into the body in the first place. It's not that aggressive when it first gets in, but we know that other tick-borne diseases can be spread within minutes after the tick latches onto the person. So the idea that Lyme disease doesn't even get into the body unless the tick has been on the body for any length of time, like an hour, is not based on any research. This is all made up concepts. So my recommendation is to treat Lyme disease very aggressively, even acute Lyme disease. And when somebody has a simple exposure, just a tick bite, I always treat for 10 days. I assume they've got acute Lyme disease at that point because we don't have any way of tracking whether a person is truly infected and whether we've cured them if they are infected. So this concept is it just an infection? There are many people that think that it's an infection with the organism that causes the Lyme infection, but that there are other co-infections going on too. So is it just an infection with one organism or is it multiple organisms? Well, I'm not going to answer that today. I'm just saying that we don't know a lot about it. So that when we talk about chronic Lyme disease, we're making guesses. And so what I'm going to be sharing with you are my best guesses based on now more than 30 years of medical practice and treating Lyme disease for more than 30 years. So there are some things we do know, and I like to share the things we do know right now. First of all, the organism that we talk about causing Lyme disease, I'm not going to get into the fancy name, but it's called a spirochete, which means it looks like a corkscrew under the microscope. But what we know about this spirochete is that it can transform into a completely different shape, which looks more like a globe, and that's called a persister cell. Now, this persister cell is kind of like our jets that have a radar evading technology, and essentially the immune system has a hard time seeing persister cells. And not only that, this cell can go inside our cells and shed its part of its surface and make itself even more invisible to our immune system. So clearly, the persister cell form of Lyme disease, it's the same organism, it's just morphed into a different shape. This can evade the immune system. Now, to make things even worse is this thing called biofilm. So what is biofilm? It's a gelatinous-like substance that these persister cells can create as a colony. It's basically a colony of persister cells, and these persister cells can embed themselves in this biofilm. Now, we've known this to be a laboratory phenomenon for some time, but it was only recently discovered that this is present in people. And that's one of the reasons that we can't get rid of Lyme disease in a lot of people, because it can form this biofilm form. And once it forms the biofilm form, it actually creates a physical barrier to antibiotics penetrating. And so even in the best of cases, with the best antibiotic that we have, the most effective antibiotic, only 50% of the time does the antibiotic penetrate the biofilm to the extent that it can kill the persister cells that are inside the biofilm. So that means that at least 50% of the time, even for durations of therapy for a long period of time, with our best antibiotics, it's not going to kill the organisms off completely. So what are we going to do about that? Well, part of the issue is Lyme disease just an infection? And the answer is, I don't think so. It's partially an infection, but it's a lot more mysterious than that, because we have DNA evidence that the Lyme organism has been in humans for hundreds of years, and and a variant of this organism has been in humans for thousands of years. So the germ being in us is not new. What's new is that the germ being in us causing disease, that's what's new. Now, either that germ has changed or we've changed. It's got to be one of those two things. Now, what we do know is that we have changed. There are conspiracy theories out there that say that somebody changed the Lyme organism genetically and made it much more aggressive. I'm not going to go there. I think that's unlikely, but there is no question that we've changed. How have we changed? Well, since I've been in medical practice, we've become what I would call a toxic waste dump. Now, when I was growing up, there was a whole bunch of attention being given to pollution. And at that time, pollution was very visible. You could see it. The skies had what we called smog. But since we've cleaned up the air and we don't have smog in the United States, at least, although some countries are the smog is so bad they can't even breathe hardly, we have thousands of chemicals now that we can't see, we can't smell, we can't taste, but are in our environment. And most importantly, they're in our food. And so since the early 1980s, and then starting in the late 1980s, we've seen an explosion of multiple health problems that parallel the production and release of multiple chemicals into the environment. One of them, the most deadly, being glyphosate, which is the main ingredient in a very popular weed killer, which I won't name the name of it, but is currently implicated in multiple diseases. And recently, a couple of cases have been settled as it being a cause for a couple of patients' cancer. So we know it does a whole lot worse than cause cancer, and cancer is pretty bad. But as far as affecting, what I mean a whole lot worse, it's hard to get worse than cancer, but what I mean is that it's a whole lot worse than affecting a few people causing cancer, because it's affecting almost everybody, causing disturbances in our immune system. So what happens in the gut with glyphosate is that the gut is damaged in three ways at least. Number one, it kills off certain species of bacteria because glyphosate is a potent antibiotic. Number two, it destroys the communication system between the bacteria. And number three, it damages the small bowel lining, in fact, the whole entire bowel lining, and makes the cells sort of leaky between themselves so that stuff gets through. And the concept of leaky gut is not just a myth, it's a real thing. And so we've got a lot more junk getting into our bodies than we used to have. And that affects immune function dramatically. And the body, if it cannot get rid of a toxin, what it does is it stores it. Now, we used to think that the body stored toxins in the fat cells. Now we know that it stores toxins all over the body, and each organ has its own special place that the body, in its own intelligence, decides to store toxins. Now, if cells are being used to sequester toxins because the body can't figure out how to get rid of those toxins, those cells become good hiding places for the Lyme organism. The immune system simply doesn't work to find the Lyme organism and kill it off. And as we've already talked about, the limitations that antibiotics have. So I believe that Lyme disease is a combination of an infection by an organism that didn't used to bother us, or most of the time it didn't bother us because our immune systems were more robust, and it is now a combination of infection and toxicity that causes us to not have a robust immune response to this organism, and antibiotics don't work well. So one of the questions is, what are the Lyme disease symptoms? Lyme disease symptoms, and the answer is virtually everything. Lyme disease is the great mimicker. It literally can imitate any disease you can think of, any organ system you can think of. It can be in. It involves the heart in lots of different ways. It can cause irregular heartbeats. It can even cause cardiac It can cause death because of damage to the heart. It can infect the brain and causes a variety of neurological symptoms, a whole host of different symptoms that are often misdiagnosed as MS, sometimes misdiagnosed as Alzheimer's disease. And I have seen just about every version of neurological symptom that would have been diagnosed as something else because of the unique ways that Lyme disease can infect discrete areas and cause a symptom complex. So the symptoms are, but I think it's useful to differentiate, are they peripheral to the brain or central? Because if they're peripheral to the brain, then shorter treatment courses, when treatment is used, will be effective. And if it's the brain is involved, you've got to sustain treatment for a long period of time if you hope to have anything resembling a cure. So what should proper Lyme disease treatment look like? Well, if what I just said is true, just throwing an antibiotic at somebody isn't going to cure Lyme disease. It'll suppress the symptoms for a while, but it's not going to completely cure it. And I've had too many patients with really substantial symptoms who got better, and then even years later, they came back with the identical symptoms. So it wasn't a new infection. It was a re-establishment of the old infection that never went away. A little bit like how shingles is the same germ that somebody had when they had chickenpox, and decades later, it's infecting the body again. So Lyme disease can hide out for reasons that I just described, and then reassert itself at times that are sort of mysterious to us. So treatment needs to focus on, in my opinion, restoration of the GI tract so that you can restore the immune system to a very robust level. And so I always focus on this when I treat patients, whether I use an antibiotic or whether I use natural substances to kill the Lyme organism. So treatment must involve restoration of the GI tract and restoration of the immune system, or else it just isn't going to work in the long run. So I'd like to talk just briefly about the benefits of a natural program over antibiotic therapy. What are the benefits? Well, because I've already mentioned that one of the things that has happened from chemical exposure is damage to the GI tract, which is damage to the biome. Obviously, antibiotics are going to do the same thing. So when we use antibiotics to kill Lyme disease, we inevitably are sort of shooting ourselves in the foot at the same time, because we're damaging the gut balance, the bacterial balance, which we call the biome. We're damaging it. Now, that doesn't mean it can't recover, but if you can treat Lyme disease without damaging the biome in the first place, I think that's an advantage. And so that's one of the things that I think is a good thing to do when you can. Now, sometimes what I end up doing is, if somebody's really sick, we will start with antibiotic therapy and start the natural strategies at the same time. And then once they're feeling better, we'll stop the antibiotics and continue with the natural strategies. A lot of patients that I see do very well with that approach. And some of the patients I see simply start the natural program from the very beginning and do well with that. Not everybody responds to the natural program, but well over 80% do quite well with it. So the natural program that we have developed has the following elements. Number one, it focuses on teaching people how to avoid the stuff that's damaging their biome. Number two, it restores the biome in ways that are much more sophisticated than just using probiotic supplements. Number three, there are some critical nutritional supplements that are part of this restoration of the biome and restoration of the immune system. And number four, natural substances that kill the organism without damaging the biome. And finally, the last thing is learning how to eat in a way that doesn't increase inflammation, because once you've got an inflammatory disease going on, the last thing you want to do is eat in a way that's like pouring oil on the fire. Now, this approach works most of the time. And if what you're dealing with isn't working, I encourage you to try this program, because it's simple, it's non-toxic. The worst thing that can happen to you is that you'll get healthier from it, even if it doesn't completely eliminate your Lyme symptoms. But in many cases, it's going to control them very well. Now, I wouldn't say that this cures Lyme disease because, as I said, I think that it's difficult to get the Lyme organism out of the body. And there is research that suggests that only a small percentage of people actually clear the organism completely. So I'm not going to say that this cures Lyme disease completely forever and ever, but it does a very good job of suppressing symptoms and sustaining symptom relief for a long period of time once the symptoms are suppressed. So if you're looking for a strategy that doesn't involve antibiotics, or the antibiotics have been insufficient for you, or you can't tolerate antibiotics anymore, then I encourage you to click on the link below this video or on this video to get access to the Natural Lyme Disease Treatment Program. So hope this video has been helpful for you to understand what Lyme disease is and why it's more than just an infection, and you're not going to get better if you don't do more than just treat the germ. I wish you well. God bless, and have a great day.